Hello, everyone, and welcome back to Mic Check
2.
My name is Rachel.
I'm Sean.
And we are down one member today. We're missing Ajai. We're hoping that she gets well soon. We won't blast her business, but y'all keep her in our prayers. But today we have a really great episode. We're going to be talking about some new things happening at St. Hope. And today we're joined by
Our CEO and our Chief Nursing Officer. Welcome, welcome. Now, y'all know they are familiar faces, so could y'all just, for our new listeners and watchers, reintroduce yourselves real quick?
Go right ahead, ladies first.
So I'm Dr. Goodie. I'm a family nurse practitioner with a specialty in HIV and family, and I'm also the Chief Nursing Officer.
All right, well,
right.
go ahead.
Put some respect on
There's respect on that. I'm Rodney Goodie. I'm the CEO of St. Hope Foundation.
Well, we are so glad to have you both back and to talk about some new things happening. So let's go ahead and just dive into it.
As Ajai would say, dive into what?
The new topic.
All right, no, but seriously. So as you guys can see behind me, well, at least for those on YouTube, we are showing a new logo.
Ooh.
So our new logo is now St. Hope Healthcare, and we wanted to, let's go on and just start with that. So we have a new name for the organization. Where did the idea transpire for St. Hope Healthcare?
Good question. Thank y'all for having us on, and we miss Ajai as well.
Yes.
It's kind of, I want to do it from a conversation standpoint. So in the last 22 years, every time I've gone somewhere, they say, "Oh, where do you work?" As soon as I say, St. Hope Foundation, they say, "Oh, well, I've never heard of that church. Where is it located?" I'm like, "Not a church." So, or I'm sitting on a plane and, we sit next to a plane, and when you want your downtime, you really don't want to talk. But it's always that one person that's sitting next to you that got a ton of questions. They just antsy. And so he's like, so what do you do? So I'm thinking if I just say healthcare, then that ends the discussion. "Oh, you're a doctor. So where do you work? Do you have your own practice?" And I say St. Hope Foundation. And so I can see the person kind of thinking in their head, what is this organization? So St. Hope Foundation has done a lot of things in the last 22 years. It's grown quite a bit. Mm-hmm. And so the board really thought about strengthening the brand during the board retreat and figuring out what are things that we can do to make our brand more succinct, have clarity for customers, for the community to say, "Oh, we know what you do." And so another case in point is there are times we've had patients where we are located, like in Greenspoint, we're located next to several apartments. And there are patients that come in that said, "I've seen you guys logo for 2 or 3 years and I never came because I thought y'all were a church." And it really does go there. And so the healthcare was, where the board settled on. They had several other names that they thought about, but it was really more of a facelift, more of a revival of saying, really, what are we about? As we've expanded every year, we've expanded services. It's really been about expanding health services. And so healthcare, although it's a ubiquitous term, it covers so many ranges of types of medical, dental, diagnostic, pharmacy, a whole host of specialized services fall up under healthcare. So St. Hope Healthcare is where we are, and this is our new direction.
So now everybody knows. Healthcare, not church.
And I was going to add on to that, too. You know how many patients call and they'd be like, "I thought the services were free $99. And because they think, what form do I got to sign for the charity portion of the foundation? And
Negative.
It's like, oh.
Yeah, and let me add to that. I mean, honestly, it's kind of, we have other nonprofits around us, but we don't think of them as nonprofits. So Memorial Hermann, no one thinks of Memorial Hermann as a nonprofit entity, but it is.
Oh.
It's big, vast array of a system. Its structure, its entity in itself is nonprofit. But you don't hear people sitting on an airplane says, "Oh, I work at Memorial Hermann, a nonprofit." They think, "Well, you work at Memorial Hermann? What hospital? what department? So they've already associated with healthcare. And so that's really where we were going to saying, making sure that if, Sean, you're in the community and, doing your thing and they say, hey man, where you work? And you said, I work at St. Hope Healthcare. They don't have to figure out what that's all about.
Right.
Yeah.
Okay.
Yeah.
And who your pastor is.
Yeah. Right.
Who's the pastor there? Okay, so I heard you mention 22 years. So the 25th year is coming up. Do we have any other things looking forward to, like services, for example?
Yes. Part of the rebranding this year of changing the name was also rolling out new services. And today we want to talk about 3 of those new services, which are ultrasounds and CT scans and mammography. So I'm like brain dead, like, okay, what's the third one? But mammography. And so those are 3 services that we definitely want to spotlight today.
Okay, so let's go ahead and just dive into these services.
The hashtag we're diving in.
You said what?
Hashtag dive in.
I'm going to have a hashtag by end of every episode. Okay, so CT scans. For our listeners who don't know what that is, can you explain what the CT scan is and the importance of it?
Yeah, so a CT scan is basically, it stands for computer tomography, and it's basically a diagnostic procedure that a provider can order when they want to know more details about a specific area of the body. It does provide a crystal clear view, so the radiologist can give very accurate results to a provider. It can pick up anything from blood vessels, soft tissues, up to bone. So it's a very specific test. Typically, it can take a few minutes. It's not a painful procedure at all.
I was just going to ask, does it hurt?
No, it does not hurt.
So typically, what are they looking for when they order CT scans?
Different things. So they can be ordered after a patient has had a stroke or if they've been involved in some type of injury, if the provider is trying to rule out a type of tumor to an organ, just various reasons that they can be ordered.
Oh, so we definitely need that at St. Hope.
Mm-hmm.
Okay. Now, who can have a scan? Can it go from, is there a minimum age or a maximum age, or is it open to everybody?
So pretty much any patient can have a CT scan. There is no age factor or, certain body composition. Anybody can have it. We do say that in our pregnancy population, our pregnant patients, that we try to use CT scans as a last resort if they need a diagnosis that cannot be achieved with a different form of imaging.
Okay.
But otherwise, anybody can get a CT scan.
So the pregnancy ruling out is the radiation. So is it typically like a high dose of radiation? But it's still safe, I would assume.
It's a very low dose amount of radiation. It's pretty much equivalent to what a person would be exposed to in a natural environment within a year time span. So It's a very low dose.
Oh, yeah. Y'all know this environment. It's shaky out here. Okay.
Now, go ahead.
Go
I was just going to say that sounds like a really great idea just because it kind of eliminates that third party, because a lot of patients that we have, I know from like Sugar Land perspective, we have to send patients to other facilities and then have to drive somewhere, waste gas, waste time. This way, all of that's going to be in-house going forward.
Yes.
Do y'all have a location selected yet?
3 locations will be our hub spots. And so Bel Air is a spot, Northwest location is a spot, and Greens Point.
The central spot, Bel Air, y'all gonna be booming.
Y'all already got the X-ray machine.
Yeah.
Okay. And do you mention, so the scan only takes a few minutes to complete, and then the doctor already has the results instantly, or they have to kind of wait on the results?
So basically, how it works is different than an X-ray in the sense that it takes multiple images back to back to back to back.
Okay.
And it kind of takes it in layers of the body. Doing that together, it creates like a 2D, 3D image that the radiologist can look at and then interpret. But basically, the patient would come in, they may be asked to put on the examination gown. Mm-hmm. They lie back on the table slides into the scanner, and then you have these X-ray sources that kind of rotate and penetrate the body at different points. It eventually converts it into electronic signals that the computer can analyze and convert into a picture.
See, that's what I like about you, Dr. Goodie. You're going to break it down. Because I'm like, okay, I can teach that now. Like, you're going to break it down.
Yeah,
okay.
Some patients can get intimidated by going for a CT scan because it's it's a machine.
Right. They
feel like it's enclosed. It's not completely enclosed. It can make a clicking noise. So those are all things that are normal. The technician will typically give you like a button that you can push just in case you're panicking or something. And they also have a speaker inside where the technologist can speak to the patient and communicate with the patient, although they're not right there.
Oh, I gotta get fancy.
And I would think that with the comfort level of people when they go to do these kind of things, I know I've done CT scans and I get horrible levels of anxiety. Like I just go crazy. It's going to be more comforting. Like, let's say you're already in your doctor's office. Let's say I'm your patient. And I'm like, where's Dr. Goodie? Like, I can't do this. And then you can come. Would you be able to like just come on the intercom and be like, hey, it's going to be okay, relax?
Well, technically, the technician is the only person in the room. So the provider who orders the result is not technically in the room. But if there's a situation to where a patient needed to see a provider, then yes, a provider will be on site in case one is needed for emergencies or something.
Okay.
Yeah, that's kind of nice. Like, I think you're saying like the provider who referred you would still be like accessible.
And then you'll even have familiar faces, like even with the radiology team. It's the same people we've been doing like with x-rays and things of that nature. So
I just have one more question before we move on to the next service. Can a non-St. Hope patient utilize this service?
Yes.
Or is it just,
Yes.
Okay.
We're making it where any patient that needs it, whether they're a St. Hope patient or not, they can access the service.
Sounds like marketing got some, no, just kidding.
Yes, marketing got some work.
Okay, so we can go ahead and talk about ultrasounds next. I'm a little bit more interested in ultrasounds.
oh.
No, I'm just kidding. No announcements. Okay, so for our viewers who don't know what an ultrasound is, can you tell us a little bit more about it and why a person may need it, and not just for pregnancy?
And that's a good point. Just like when you just mentioned it, Sean, it's like, do you have something you want to tell us?
Absolutely not.
But a lot of people think it's specifically related to pregnancy, but it's not. So an ultrasound can be ordered by the provider if they want to get more details about a specific organ. Patients can have complaints of things like pain in the specific area, swelling. So if they need an internal view of what's going on with their organ, then an ultrasound can be ordered. Unlike CT and X-rays, it is not a source of radiation, but it basically uses sound to create an image that can be interpreted and results given to the provider.
It was sound-based. Where are my notes at? Okay, that's funny because Peyton actually gets ultrasounds, but of her brain. So, like, people often think, like, oh, it's just, no. Okay, so with ultrasounds, is there any, like, pain associated with getting that procedure?
So typically it's not a painful procedure. The area that the provider ordered the ultrasound for, they typically will apply lubrication or like jelly. And then they use a little transducer, and they may apply very slight pressure to that area, but it helps give them a better result. But it's not painful.
Because it's sound-based. I learned that today.
Look.
For everybody not watching this, if y'all could just see my face.
That's okay. I'm going to be taking my test next week, my nursing exam. I'm going to be like, she said sound. Watch, that's going to be the only question not on there. So for the ultrasound service, is it available to only St. Hope patients?
No. It includes any patient that needs the service. One of the benefits of being a community health center, FQHC center, is that we are seen as a safety net. We're seen to offer services where people don't have insurance, people have limited resources, and so this service will be one of those services that those patients can access.
And would they need like just a referral to come in for that service if they're not being seen by one of our providers?
They would need an order.
Okay. And our doctors can order it as well. Okay. Oh, one-stop shop.
One-stop shop.
Okay.
So that's 2 for 2. Everybody's available. So
all right, last one.
We're gonna go with our last new service in St. Hope, mammography. Now, could you just give me an idea of what exactly is a mammogram? What is the mammogram and what are the benefits of it?
So a mammogram is basically a type of imaging method that can help detect breast cancer. It does use low dose radiation, so it's like an X-ray that helps visualize the breast tissue. So people that may need a mammogram, according to guidelines, women who are age 50, they should definitely start getting mammograms, and they should get it every other year. If they have higher risk for getting breast cancer, then they should screen a little bit sooner. The benefit of getting the mammogram is that it can detect changes in the breasts before a woman can notice them herself with just the breast self-examination.
And if y'all don't remember, she was on our breast cancer awareness episode. It taught us all about breast health.
She actually did the whole kind of...
Yeah, she was on here like in the clock.
Yeah.
Now, I did learn something on that episode too. You're not supposed to check your breast when your cycle is coming because your hormones are changing because you'll be all
over the place.
Yeah, you'll be like, oh, Lord, it's here. And just
Nothing.
Panicking for nothing.
So,
okay.
Go ahead.
So are there some barriers, so like why women may not be accessing this service?
So cost is definitely one. It can be expensive if you don't have insurance. Another barrier is, just having fear of the exam itself. A lot of people perceive that it's going to be painful, and it should not be painful, but it's not comfortable.
Okay.
So those two are probably the biggest barriers.
So I'm assuming we'll be competitive pricing.
Yes.
But still.
Yes. Definitely.
Everybody's like,
Definitely.
Sorry, everybody during that question.
No, definitely. I think when you look at the spectrum of costs for patients, definitely community health centers really strive to be affordable, sliding fee scale, trying to offer it based on what that person's FPL level is. And in this case, we've always looked at things as far as in this type of service area to definitely be about 20 to 30% less expensive than what the market is actually bearing.
We love that.
Okay. And I'll go back to it. You save gas, time, convenience is a big thing for me. So
it is.
If I come to, if I want to see you, schedule an appointment, I say, hey, Dr. Goodie, I want to do a mammogram. I feel like a lump. We could schedule that. Something's wrong with my leg. We could schedule an ultrasound. If we want to do my labs, everything is right then and there. You don't have to hop all around. Everything's right at your in particular location.
So you said we're 2 for
as long as it's Bel Air, Greens Point, and Northwest. And if you're from Sugar Land or Conroe, those aren't far away from the other locations.
Coming soon, I'm assuming. Coming soon.
Coming soon.
To a center near you.
Yes.
To a healthcare center near you. Okay, so we are 2 for 3 of the services being available, even if you're not a St. Hope patient. So will the mammograms be available if you're not a St. Hope patient as well?
Yes, it will be.
Oh, well, there we go.
We're batting 1,000.
Yeah.
We are 3 for 3.
3 for 3.
We're like Steph Curry tonight.
You gotta say threes. Okay, so that's awesome because I do know we do refer a lot out for that service, especially. I know one of our main providers, Wallace. I know she refers out a lot for that, so that'd be nice. Is that only at those 3 locations as well, or?
Mammography will be offered at Greens Point and Northwest. It's already active at Northwest, so it's up and running.
Oh, y'all hear that? Y'all heard it first.
So with the self-pay and the FPLs and our sliding scales, do we have an estimated range of what patients could possibly be looking forward to as far as pricing?
We do. Like I said, if they went and compared it against the market, it's definitely going to be at least 25 to 30% cheaper than what they'll see on the market. As far as the actual dollar, I don't have that in front of me. And typically, we don't really like to say a dollar number because it really is dependent on your FPL level.
Right.
Yeah.
And we know that upsets the patients a lot, but it really does go off your income level and your family household size. We got a whole little calculation sheet.
Yeah, just to speak to that, I think, inflation has hit everybody across the board. And so everybody's looking at their coins and counting them and measuring and saying, how do I maximize and get the things I need? And so, our patients, because they have limited resources, are often like Lucille Ball, spinning that table to see what bill stays on to pay, and they're trying to figure out what is most important this month. And so I think it's important for us to, as a healthcare center, to make sure the services are affordable, integrated, figuring out ways to save them money so that they can have that money to do other things with.
to have good quality care. So I know you mentioned that one of the services is already up and running at Northwest. So are any of the other 2 ultrasounds or CT scans going live soon? Do we have like a go live date for those?
The ultrasound for Bel Air, we're looking at the installation of the equipment will happen later this month. And so once that's done and they go through a few tests and certifications or calibrations, we're looking at July for that to go live. We're anticipating the Greenspoint location, once the build out is done, that's November. So that is where we're looking at everything to go live there. Northwest and Bel Air are the sites that will probably have the more recent sites to start up.
Nice. So y'all heard it first, July. I didn't realize until I became like really an adult how time flies. Like it's already May.
Yes.
And it's just like, what happened? Like
He's already saying by the end of this month, we're already going to have.
I know. We're already going to be doing our 6-month check-in from our New Year's resolutions.
I thought you were going to say 6-year anniversary.
No.
Thank you for bringing that up.
But as a reminder.
I am so honored that you said that on here. I made 6 years with St. Hope Healthcare. Formerly known, you gotta be like, formerly known as. But yes, it's been a very, very much so an honor to be here. So we have some exciting things happening. So 3 new services. 1 is already live. 2 are coming soon to our Bel Air location. We got a new logo. Can we expect anything else?
Oh, yeah. We got some more new stuff coming, and those are the 3 newest. But probably in Q3, the fall, say August, September, we will be offering Botox services. At all sites.
Cosmetics.
Yes. We talked about this, I think, the last time a little bit when I was on about starting a business. And so y'all asked about the new services. So we're excited to say that that has moved along very well.
Oh, nice.
So make sure you stay tuned to the website, I'm assuming, for announcements as far as Botox scheduling.
It's coming out. So
you're trying to see when you can sign up.
And big question
Yeah, she see Sean face. You trying to he said, he trying to pick up that
he went to the crow's feet like, okay, this is where I need to get the work.
Now, I saw a volunteer sheet. I said, I'm going to wait till about 10 or 11, just so y'all can, really work it out.
Interestingly, we're in the piloting phase, and we sent it out to the staff, and we have probably about 40 staff already signed up to be a volunteer. So we haven't really done the volunteer to the general community because we know the demand is high. But we will say that once we go live, that the price will be, again, significantly cheaper than what they would receive.
Now,
in other sets.
Is there going to be like a special doctor that does that? Or is that going to be like, I could just schedule anybody and any of our providers can administer?
We're starting with 4 providers.
Okay.
And so our hope is to expand it once the 4 providers become champions. And so those 4 providers, we made sure, Sean, that they cover all sites. And so that way we could cover any site to offer that service.
Now, I will say they had a training, and the people they practiced on came back looking brand refreshed.
You're about to say brand new, aren't you?
Everybody usually has their Zoom off. Their volunteer patients, everybody's Zoom camera was on that following Monday. They was smiling and cheesing. They had all the lights on. Usually, when the cameras come on, everybody's like, no camera me. No, all the
dark circles. Nothing.
They was smiling, just waiting on their compliment, So y'all really did really good work. Just for practicing out. So I'm looking forward to that service.
We got a lot of stuff coming.
Hopefully I don't need it soon, Lord. Okay. That's my Ajai comment.
But that just made me think of something. So it's not always when you already have wrinkles. It can be used as a prevention for wrinkles. So
that was Ajai. That's Ajai's comment. We try to know. Because Ajai's always like, you got to start at 30 with your Botox. So that's good. Okay. Nice. And we also have another event coming up, too. I just want to plug it in real quick. The Grape Escape.
Yes.
So that is our fundraiser. So would you like to tell us a little bit more about that?
Absolutely.
How long have we been doing the Grape Escape?
This is our 6th year, I believe, that we've been doing it. Yes.
6 is the number.
6. Oh my goodness.
Just bringing all the good.
Yes, 6 is a popular number today. But yeah, 6 years we've been doing it. Last year we were able to raise $75,000.
Oh,
We have a
nice.
goal to try to reach $100,000. It's in Herman Park at Lot Hall, and the beauty of that place is it's indoor and outdoor. So you can be out on the patio and listening to the Latin music, or you can say this Texas heat is too much for me, and come inside and drink your wine and have your pairing and enjoy your fellowship with your friends. So it's a really nice event.
Yeah, I think this will be my 3rd year going. I've enjoyed it. It's very nice.
Yes.
I think that's
And there are other things that we do. So there, it's some other little cool things that we do that people take away from it, like the 360. They love that. So yeah, really
The
exciting.
music is good too.
So if somebody was interested in doing a donation or buying a ticket to the event, how would they go about doing that?
They can go to our website, offeringhope.org. Look to the far right of the tab. You see Grape Escape, and then there are sponsorship levels that they can select. They'll have up until Wednesday of next week to secure a sponsorship. Depending on the sponsorship level, it gives you a certain number of tickets complimentary with the event, along with some giveaway promotional items, and they get recognized at the event. And so we are still taking sponsors. I'm glad you brought that up. So we want folks to come on out and support this one really great cause.
It's a great marketing event. Like if you have your own business or some things like that. But also, you did mention Wednesday would be the deadline. We will release this on Wednesday, so y'all better rush over there and get your tickets.
Immediately.
So immediately over
We'll
there
give them till Thursday.
Yes, okay.
We'll give them till Thursday.
to launch this one. Okay, good. Okay, see, we give y'all a
Troy,
little wiggle
Troy
room.
may not like this because he has to do the digital design of new logos.
Y'all can see Troy's face
Yeah,
right now.
Troy is just
Troy back
like
there in the back, like
he went silent. Usually he's like that
Right.
smiling. Yeah, Troy is like
deadline.
That's it. Well, we really appreciate y'all coming on and kind of telling us a little bit new what's going on with St. Hope Healthcare. It's going to
Healthcare.
take a little practice. 6 years, y'all. 6 years of foundation. But I really do admire the healthcare because it shows you like what we're really about with the medical, the dental, like the one-stop pharmacy, and just really good quality care. So you don't have to explain. My pastor don't work there. So I really enjoyed that. So that's a really awesome change.
And did you guys have anything else y'all wanted to add before we let y'all go? Any little tidbits?
I just wanted to say I'm excited about all of the new services, and I'm excited to see how it will help improve our patients' outcomes. So thank you for having us so we can highlight that.
Yes, thank you for having us, and thanks Dr. Goodie for coming on. I kind of pulled her leg.
Voluntold.
She voluntold. And so she did great, as she normally does.
Awesome job. I'm telling you, I always walk away with like, okay,
a little tidbit. A little something.
my little note section is be booming. Okay, so Sean, you gonna close us out for our?
I'm gonna try this now. I'm not as good as Ajai. I can't. Nah, I can't. Just kidding, Ajai. But if you guys are interested in any of our imaging services coming up, or even if you just want to schedule an appointment, you can always visit offeringhope.org. You can use our chat feature to schedule an appointment, or you can call 713-778-1300. And here's St. Hope Healthcare. You're more than just a number.
Oh,
All right.
thank you, Troy.
Thank you.
Very good.